Hi, everyone. My name is Dan Webb. I work with the Focus Coalition on data collection and data reporting. And right now, we will be talking about the results of some key informant interviews and focus groups that the coalition has conducted over the past couple of months. So, pretty small agenda, but there's a lot of information that you'll be getting over the next 20 minutes here. First thing we'll do is talk briefly about the background of the Focus Coalition. Then we will talk a little bit of background on key informant interviews and focus groups themselves. From there, we will move to results from Focus's first round of key informant interviews and focus groups. And we will wrap up with some next steps. What can we do with that information? If anybody has any questions about the presentation, the email addresses are at the bottom of your screen there. I'm at the bottom right. And Gwendolyn Bork, the president of Focus, her contact information is at the bottom left. So jumping right into it, some background on the 4-Hour Community Unity and Support, or Focus Coalition. The coalition was awarded a federal drug-free communities grant in 2019. This is a highly competitive grant, and about 100 coalitions or thereabouts get the grant each year. And the purpose of the grant is to fund communities to assist with the prevention of youth substance use. So preventing our youth from starting to use substances. And as part of these as part of the grant, we do have a requirement to collect data on the local community. So everything that the coalition does must be data driven. So we need to collect a lot of information on what's happening in the community and respond accordingly. And to that point, there are many different ways to collect data. And tonight we will be talking specifically about key informant interviews and focus groups with a little bit of discussion about surveys as well. So a little bit of background on key informant interviews and focus groups. So as I mentioned, we'll talk a little bit about surveys. There was the administration of a district-wide student survey in 2019. It's called the Prevention Needs Assessment Survey. And this survey, it gives us a lot of good information, but it is quantitative information that needs more context in order to act on. And by quantitative information, I mean numbers. So the percentage of students that said that they've used alcohol, the percentage of students that said that they've had mental health concerns, et cetera, et cetera. So in order to build on that information, Focus designed a series of key informant interviews and focus group questions. And why is it that key informant interviews and focus groups are the right way to go after administering a survey? So a few points here at the bottom. One is that you can really dive in to a topic or a series of topics with interviews and focus groups. So this first point giving us more detailed information in surveys. So instead of, say, for example, knowing that 27% of students used alcohol in the past 30 days, that's great to know, but we also want to know why that's happening, where that's happening, how is that happening, how are the youth getting access to the alcohol? Those sorts of topics and those sorts of questions you can really sort of expand on and get a lot of good qualitative feedback. We're talking here about words and thoughts and feelings and attitudes. And that gets to my second point here, allowing researchers to explore topics in depth. So as I mentioned, just knowing that a certain percentage of students used alcohol is one thing, but knowing how and why and where and when is a totally different story. And you really need to use qualitative data collection methods like key informant interviews and focus groups to get that information. And the final point here is to allow researchers to fill in gaps of knowledge. So surveys are great, and the survey that was administered in the Lancaster and Depew schools in 2019 is very comprehensive. That being said, there is always room for more information and more context to understand why things are happening in our community. And so key informant interviews and focus groups are a great way to fill in those gaps of knowledge. So you might ask, how are focus groups and interviews set up? And I think these two pictures probably tell you everything that you need to know. Unfortunately, focus groups often do end up looking like this picture on the left here, where people are kind of doing their own things. And that's why it's important to have a skilled facilitator to be able to manage groups and ask questions in a proper way and make sure that everybody is involved and giving feedback. And we're lucky to have good facilitators in for focus and a good set of focus group questions. And so this is the way it's generally set up. Obviously, in times of COVID, focus groups are being carried out over Zoom, that sort of thing. But this is your traditional focus group setup. You get everybody in to a room. Everybody, has a name tag or some way of identifying themselves, and everybody kind of just talks about the questions that are posed to them by the facilitator. And there are no right or wrong answers. It's really just, what is everybody thinking? And there are a lot more rules to sort of administering focus groups, but that's generally the way. That's sort of a high level look at focus groups. Interviews, as you can see here, are a little bit more targeted, right? So here on the left side, we're kind of getting feedback from a lot of different breeds of dog, a couple cats here, and we're getting a lot of different viewpoints. And on the right, what we have is really just choosing one person, in this case, a dog here, that is going to be giving us information, and just information from that person. And that's why we call them key informant interviews, because in most cases, what we want to do is choose somebody who has experience working in the community, and specifically working in the community with regard to the topics that we are interested in. So in this case, asking law enforcement officials and school officials and youth to give us feedback on marijuana, which was what this first round of focus groups and interviews was about. Asking them, they live in the community every day, they see what's happening, and they can give us a lot of great, very detailed information. So what did the coalition ask respondents? So the survey that we referred to earlier, a couple of the main findings were that there's an increase in marijuana use and decrease in perception of harm of marijuana use. This is not unique to the Lancaster and Depew communities. This is something that is pretty prevalent across the entire United States. We're going to talk about reasons for that as we move through this presentation. But the idea here was to have focus representatives ask students in focus group settings and key informants in interview settings about the following topics. And these are not the questions themselves, these are the topics. So how is marijuana use viewed by youth and adults in the Lancaster Depew community, including in general and in specific locations? So what is the general feeling about marijuana use in the community? And then, what is the specific feeling about marijuana use in the school setting? And that was the only specific setting we talked about in this particular round, but we could also ask about marijuana use in other settings. The second topic area was about the health effects of marijuana. So as we saw decreases in perception of harm of marijuana use, we want to figure out why that is. How youth obtain marijuana, that's point 3 there. So where is it coming from? It's more accessible than ever, but what specific ways in the Lancaster Depew community are being used? And where youth use marijuana. So once you have the marijuana, of course, you have to find a place to use it. And marijuana, actually, given the number of ways and methods, delivery methods to use marijuana, whether it's eating or smoking or vaping. There are a lot of ways to hide marijuana use. So we were interested to find out where youth are most commonly using marijuana. So finding number one, there is low perceived risk of marijuana use. So many community residents, and this was true for both youth and adults, think that marijuana use does not pose health risks. And some specific examples of what was said in regards to questions about the health risks of marijuana use. A big one that was repeated many times, it's not a big deal. So it's just not a big deal anymore. The risk is worth the effects. So I may be struggling with mental health, and therefore I will use marijuana, even though I know it may be risky. It does help me feel better about my situation, and therefore it's a cost benefit analysis that leads to use. Marijuana being not as bad as alcohol. So it's sort of, this is a lesser of two evils argument here, where we're saying, okay, you're not getting blackout drunk and driving a car, so therefore marijuana is, it's a less risky, marijuana use is a less risky behavior than alcohol use, for example. Also, what we found is that there seems to be a lack of education about the effects of marijuana on the developing brain. The brain develops until about age 25, or maybe even a little after. There's a lot of research out on that. And if you use marijuana or other substances as your brain is developing, there is potential for long-term effects, negative effects. And as age increases, perception of risk decreases. So that's another finding here, is that as students get older, their perceived harm of marijuana use decreases. That could be due to exposure to marijuana itself, or pro-marijuana media, older friends, older siblings, all of those sorts of things. So as you can see, as kind of demonstrated, a picture on the left here of an urban free climber. This person here either knows the risks and decides to engage in the behavior anyway, or does not know the risks and is engaging in something that she does not quite know how harmful it could be, which when you're that high up, you must know the harm, and you must know what you're getting yourself into. So the next finding, changing social norms are making it more acceptable and easier to use marijuana. So as everybody probably knows, in the US, social norms about marijuana are quickly changing, and marijuana use is becoming more widely accepted for a variety of uses and reasons. And that came out in our focus groups and our key informant interviews. So some examples, it's going to be legal soon. So the legality or the decriminalization is really having an effect on youth attitudes and beliefs. It's used for medical purposes. So if a doctor can prescribe it, or if it's used, if it can help people who, let's say, have seizures, well, it must be okay if a doctor prescribes. It's kind of the same thing that we find with prescription drugs, right? If somebody reputable is giving them to you, well, it must be okay and must be harmless. There's decreased stigma of marijuana use, no more discussion of, or less discussion about, potheads or burnouts or these sorts of things that you used to hear about. Marijuana is commonly used by youth now, so it's just a more accepted behavior across the board. And co-occurring usage of marijuana and alcohol. That's something that I think we need to look at as a community, is the sort of the co-occurring usage of substances, and really sort of that self-medication that we talked about earlier. Finding 3, there are more ways than ever to get and use marijuana. So you see this very complex series of interconnections here in this highway on the left, right? This is kind of a way to envision the ways that youth can get and use marijuana. So along with decreased perception of risk and changing social norms about marijuana use, come more ways to get and use marijuana. So some examples here: marijuana comes in many forms: smoked, edible, vaped, topicals, creams, etc. It can be easy to hide, depending on the form. It can be very hard to detect depending on the form that you use. Of course, if you smoke um, a pipe or something like that, there is obviously a strong smell associated with it. But if you eat something or use a topical, it's going to be much harder to detect. And youth getting marijuana from older siblings and friends, older youth with connections, parents who approve of marijuana use, social media, posting on Snapchat, come and get it, it's available, and dealers and runners. Runners would be people that, go somewhere, maybe, outside of our community to get marijuana. And then using marijuana, once you have it, as we talked about, you need to know where to use it and where it's safe to use it, and in terms of not being caught. What you see on the left here is Como Park, right? This is a map of Como Park. And you can see just in this one park, there are many shelters. And if I'm sure everybody on this webinar or Zoom, I guess that's what we call them now, has been to Como Park and knows that there are a lot of areas that are sort of out of the way where you might be able to use marijuana, use alcohol, just be out of the way. And so it's interesting, although youth did believe there would be strong consequences if they were caught using marijuana. So suspension from school, kicked off the school sports teams, you know, even stronger consequences than that if you're a repeat offender. They also know that there are places they can use without being caught. And some examples that were brought up were at home, at their own home or at friends' homes, especially if parents are sort of cool with marijuana use. Kids will gravitate to those homes. In their cars, so just kind of driving around or pulling over and using marijuana. At local parks like Como Park and the other parks in the Lancaster Depew community, and even, believe it or not, in school. So although there are very strong messages and very strong consequences to not using marijuana in school, some youth have reported and adults have reported throughout this process that kids will come to school high or eat brownies in the cafeteria, or anything from A to Z. And that again comes from the difficulty in detecting and the ease of hiding marijuana. So just to wrap up here, some ways to address the issues Focus found through their latest data collection efforts include providing education on the risks of marijuana use. This is one of the big things that needs to happen for both adults and youth, really getting out there and letting adults know that regardless of their opinion on adult usage of marijuana, the youth brain is developing, and we do not want our youth using marijuana because it will interfere with the development of youth brains and will have long-term effects if that happens. Working to counter messaging in the mass media. So as we see an explosion of pro-marijuana media, coalitions like Focus can use their federal funding to counter that mass messaging. So, or that messaging in the mass media. So whether that's taking out ad buys in social media platforms, or doing social norming, sort of saying, okay, well, 90% of students did not use marijuana, putting that sort of thing throughout schools, letting know that it's not the norm to use marijuana. That sort of messaging is important. Working to understand and reduce social access. So knowing where youth are getting marijuana from and working to limit that access is something that the coalition can also focus on. And working with schools to send clear messaging about marijuana. So although that is already seems to be in place, I think it's something, given the fact that students said that they still can use marijuana in the school setting, working with, and since schools are the heart of the community, working with schools to keep consistent messaging about marijuana use and the dangerous effects of marijuana use on youth is another next step that the coalition can take. So that is all I have for you today. Again, my name is Dan Webb. It was really great to be with you tonight. And I hope you found this to be useful. And I hope you have a good night. So thanks again and take care.